Well, neurosurgery is the surgical treatment specialty involving disorders of the brain, spine, spinal cord, and peripheral nerves. And here we do have a full-service neurosurgery center where we can be involved with trauma, with tumors, with degenerative processes. Most commonly, what we see relate to degenerative changes and injuries in the spine. Treatment can include non-surgical treatment, as well as the potential for removal of herniated discs, fusions of the spine, and numerous types of surgical problems that we can deal with.
I got an MRI done, and they took a look and it found out that I had a slipped disc in my neck that was pinching a nerve in my arm here, so that was causing the big problems. Oh my gosh, so easy. It was just, after going through the MRI and so forth, it was just a matter of just getting things set up in his office, and then getting everything scheduled and then going and having the surgery done. The process itself was so simple, and I felt so comfortable in speaking with his assistants and him himself, and just really put me at ease for sure. I've just been just from walking into the Orthopedic and Neurosciences Center here at Memorial, you just immediately have a sense of professionalism and calmness and cleanliness, and it doesn't seem like things are being rushed around and kind of crazy. You just feel at ease, and his office was even better, just very comfortable, very at ease, and I've just been so pleased with my whole experience.
In the Orthopedic and Neurosciences Center, we have a broad range of physicians and ancillary services available to our patients, so that if a person comes into the center and sees a surgeon but really does not need surgery, then that person can still be treated here in the center by other physicians and other services. We have physical therapy, we have physical medicine, and pain management and orthopedic surgery, in addition to neurosurgery right here in the center. In addition, we have capabilities for diagnostic studies. If you come and see me in my office, we need an x-ray right away and come back to the office, you just go one floor up and get the x-ray and come right back. And so it's really quite easy and is very helpful, I think, to the patients to have all of those services in one area.
So after we confirmed the diagnosis, he referred me back to physical therapy, to try, deep tissue treatments and exercises, but it was found during the course of testing and evaluation I had more weakness in my arm than I thought. And with the muscle weakness, that was the key to decide on surgical decompression of the nerve. Well, I'm a big believer in coordination of care. That's my bread and butter. And I feel strongly that Memorial has a head start on everybody. They seem very well coordinated between therapy, surgery, and then post-operative therapy. And because everything seems to be under one roof, even though we're separate buildings, it seems easier to arrange for the appropriate follow-ups.
It's a one-stop shop, so to speak. I mean, you're not going to the hospital, so to speak. You're going to if you have an issue, with this sort of thing, you're going to the Orthopedic and Neurosciences Center that's going to take care of all of that with just phenomenal professionals and a very clean and professional environment. This center and Dr. Hefner, you would expect something like this perhaps in New York City or Los Angeles or something like this, but here it is right here in Belleville, right? And what an amazing resource it is, and I'm so thankful.